Oxygen therapy increases the amount of oxygen that your cells receive. There are three basic oxygen therapy techniques. First is breathing supplemental oxygen. Second is hyperbaric therapy, which uses external pressure to push more oxygen deeper into your body. And third is LiveO2 training that uses internal pressure with exertion to deliver very high amounts of oxygen to your cells through the vascular system. The benefits of each therapy are proportional to how much more energy the therapy enables your cells to make and for how long. Supplemental oxygen is a standard therapy when blood oxygen levels are low. This therapy assumes that the oxygen in the blood can always reach cells. This is often untrue due to inflammation, injury, or disease. Hyperbaric is the most recognized oxygen therapy. It uses external pressure to push oxygen to your cells. It works much better than supplemental oxygen because the extra pressure forces more oxygen deeper. With hyperbaric, your cells enjoy extra oxygen while the pressure is present. But then, tissue oxygen levels return to normal very quickly after the therapy ends. So, neither supplemental oxygen nor hyperbaric create a permanent increase in cell energy, unlike LiveO2. Oxygen is helpful for any condition that causes low oxygen in tissue. This includes most diseases, even the cold and flu, which cause a lung injury and reduce the entire or whole body oxygen level. Oxygen therapy helps the body heal because it increases the amount of oxygen available to your cells to make energy. Extra energy from extra oxygen will help all wounds heal faster and accelerate recovery for about every condition. Virtually all injuries and diseases create low oxygen areas because the injury or the disease tends to damage the blood supply. This is why hyperbaric chambers almost always help wounds or injuries heal faster. Most diseases damage the vascular system and reduce the oxygen delivery to tissue because they interfere with your body's ability to deliver oxygen, therefore the cell's ability to make energy. This is true for virtually all infections and even autoimmune disorders. If you give a man a fish, you feed him for a day. Supplemental oxygen and hyperbaric treatments oxygenate the body for an hour or two. But if you teach a man to fish, you'll feed him for a lifetime. And LiveO2 oxygenates forever. LiveO2 is more advanced, combining exertion with oxygen to radically enhance results and make them last a long time because it hybridizes oxygen and exercise. This chart shows how oxygen use increases for over a year after only 3 LiveO2 sessions. On the left, we see oxygen entering the capillary is about 84 and the oxygen exiting is 40. This difference, combining the extra blood flow, illustrates that about 22% of the oxygen that enters the tissues leaves. After only one LiveO2 session, that percentage increases to 40%. By the second session, it increases to 54%, and by the third session, it stabilizes at 52 to 49%. And that this 49% oxygen utilization fact is still present after 15 days. Measuring a year later, most of the increase in oxygen utilization by the tissue is still present. That's why we say LiveO2 creates a permanent, and if we look at the total amount of energy that your cells are able to produce because of LiveO2, it's both substantial and it lasts. Many people ask what's the difference between LiveO2 and a hyperbaric chamber. Well, hyperbaric chambers and LiveO2 are very different technologies. A hyperbaric chamber is a pressurized compartment, while LiveO2 is a training system that teaches your body to oxygenate your cells. Now, both deliver extra oxygen, but they work very differently and produce very different results. Here's a picture of a hyperbaric chamber. It's basically a chamber or compartment that you crawl inside and more or less lay down, and the pressure increases, forcing more oxygen into your body while you're inside the tube. Now, when you come out, the extra pressure goes away and the extra oxygen diffuses out of your body. So the extra oxygen from a hyperbaric chamber only lasts while you're in the chamber. This is a user on LiveO2. You'll notice that he's exercising. We're switching him from an oxygen-rich to an oxygen-reduced environment. The exertion is causing his heart rate to increase, so we're maximizing the volume of blood that's flowing through his system. When we switch from an oxygen-poor to an oxygen-rich environment, we're creating a simultaneous maximum of oxygen volume flowing through his body and oxygen dissolved in blood. This is the secret of how LiveO2 is able to create not only the maximum oxygen possible, but to create durable effects. Many people wonder about when you should use hyperbaric versus LiveO2. Hyperbaric chambers are best for immobilized or paralyzed users, because if you can't exercise, you can't really use LiveO2. But LiveO2 is preferable for able-bodied users capable of mild to even intense exercise, or anyone who can tolerate being in a sauna for hyperthermia. Now, hyperbaric chambers are a medical therapy system used to treat medical problems. LiveO2 is not a medical system. LiveO2 is an exercise or training platform that's designed to maximize your health regardless of how healthy you are. You could be a professional athlete, or whether you have a health problem. Now, we've already said that hyperbaric chamber increases the oxygen while you're in the chamber. LiveO2 training increases your energy production and teaches your body how to make energy, so the effects are more permanent, like exercise. So in terms of results, we would say hyperbaric is slow. Normally it will take approximately 40 hours to create the effect or achieve a therapeutic benefit within hyperbaric. Now, LiveO2 tends to be fast. Most of our users will observe physiological changes within 15 minutes. Hyperbaric is passive. You just lay there, while LiveO2 is active. You exercise, work out, or do something to increase the heart rate and create a physiological challenge for the body to get the heart rate up. Hyperbaric is used for medical health support. It requires a prescription. Usually it requires an attendant. LiveO2 is used for health restoration, anti-aging, and even athletic training. Most people don't realize the difference in hyperbaric chambers and are confused. To start with, a hyperbaric chamber is a whole body capsule that increases the air pressure. And the increase in air pressure increases the oxygen that dissolves in your body, and the benefit of the hyperbaric chamber is proportional to the pressure capacity of the chamber, within reason. As the pressure increases, the amount of oxygen that gets squeezed into your body increases, and the more it helps your cells make energy, therefore the more you can heal. Hyperbaric chambers vary by the amount of pressure that they create. An at-home or soft-sided chamber reaches about 1.4 atmospheres, or 1.4 times more pressure than normal. Medical chambers, like you find in hospitals, go to 2 to 3 atmospheres, and military hyperbaric chambers can exceed 4 times normal pressure, or 4 atmospheres. The amount of pressure that the chamber creates determines how well and how fast the chamber works. Medical hyperbaric therapy is expensive in both time and money. A normal course of medical hyperbaric therapy runs between $10,000 and $20,000 and requires at least 40 hours of confinement in the hyperbaric chamber. Now, the confinement and pressure require medical hyperbaric treatment to provide constant attendance and supervision. In other words, self-administered hyperbaric therapy is impractical for most people because the combination of captivity and pressure cause enough risk to cause hyperbaric chambers to be considered medical devices and require prescription and professional administration.
In the transition, I was doing a hard chamber with a certified hyperbaric doctor, and on numerous occasions we discussed the difference between a soft shell chamber and a hard shell chamber. And the doctor told me that soft shell chambers, they don't have the same effect on a person that a hard shell chamber does. So at that point, when I was thinking about purchasing my own, that steered me away from it. It just didn't make sense to spend $5,000 on a piece of equipment that's not going to give me the same benefits I was experiencing in the hard shell chamber. So that's if you're looking to purchase a soft shell, do a little research, talk to doctors about it, your hyperbaric type doctors, see what they have to say. They'll tell you the reasons that the soft shells are not as effective as the hard shell chambers. So that led me to looking at the LiveO2 system.
Most people start their research about hyperbaric chambers thinking about home or soft-sided chambers. Now these, like we said before, operate at low pressures of about 1.4 atmospheres, and they cost between $5,000 and $20,000 to purchase and usually require a prescription. But these chambers have 3 limitations beyond the low pressure. First, since they operate at less than half the pressure of a medical chamber, they take at least twice as much time to produce the same results. So if you'd have to spend 40 hours in a medical chamber, you'd have to spend at least 80 hours in an at-home chamber to get the same results. A second limitation is the number of uses. Soft-sided chambers have zippers that tend to fail over time, which tends to limit their durability. Third, flexible chambers require flexibility to enter and seal. This usually means that people with limited mobility can't use them without assistance, and often not at all, because operating the zippers requires bending and some strength.
Another question you might ask yourself going from hyperbaric to LiveO2 is, can I do this by myself? Well, that was a big decision for me because hyperbarics, it took a team to help me get in and out and run the machine. With LiveO2, all by myself with a disability, paralyzed on one side, was still able to get on, fill the reservoir, flip the switch, and exercise all at the same time by myself. Needed no help. So if you're wondering if you could do this with limited abilities, absolutely. Hyperbarics, probably not.
These constraints explain why, after over 20 years, soft-sided hyperbaric chambers are in very limited use. The science is real, but the results take a long time and are often challenging to achieve.